Good evening, everyone. My name is Cindy Brown. I am with Lambda Living, a program of Jewish community services, primarily serving LGBT seniors. And we have a great night for you tonight. Little housekeeping. If your speaker is not muted, please mute it now. We're going to have Dr. Weiner is going to present first, and there'll be Q&A, and then we'll have the second presenter after that. This is part of a 4-part holistic series that Lambda Living is presenting. And the first part is tonight. We're talking about medical marijuana and CBD. The second session is in December, and we'll be focusing on cooking with CBD. And in January, we'll talk about mental health and well-being, and in February, physical health and well-being. And we hope you'll be able to join us for all of the workshops in the series. But without any further ado, I would like to introduce our main speaker for this evening, Dr. Michelle Weiner. She is one of the most highly renowned cannabis doctors in South Florida, and she is a wealth of knowledge. And listen to her, think of your questions, and we'll have time for questions and answers after that. So welcome.
Thank you. Thank you for the introduction. I'm gonna share my screen so that everybody can see the presentation. Okay, so this is the cannabis plant. So that's what I'm starting with, just so that you can respect and appreciate the fact that it is a plant and it's a natural substance that we can use for a lot of medicinal benefits. I am a pain management physician, and I did my residency in physical medicine and rehab, and I did an interventional pain fellowship, and I became frustrated with the limited tools that I had to help patients who were suffering with chronic pain. And so I started to take a more holistic, integrative approach and incorporate cannabis into my practice. And I learned a lot about the plant, and not just what it can do for pain management, but for other chronic debilitating conditions like mental health, anxiety, insomnia, cancer patients, Parkinson's, MS. So now I see a little bit of everything, which is also very exciting and very satisfying for me. I'm part of the Florida Medical Cannabis Advisory Committee through the Department of Agriculture, and I'm involved in different research programs. So most of my research is using cannabis as a substitute for opioids. We've seen 20% of patients completely reduce, completely actually wean off their opioids, and almost 50% of them wean off. I'm also doing some research with something called a nanoemulsion, which is a water-soluble form of cannabis that has a faster onset, higher bioavailability than an oil tincture. And we did some surveys recently during COVID through University of Miami, where we found that almost 20% of people that were using an inhalation route switched because of the pandemic, so that they're using more of an oral or sublingual form of cannabis. And mental health is the most common reason why people were choosing to use cannabis during the pandemic. And the fact that people want more information about terpenes, about the essential oils of the plant, about how that can benefit them. So I'm going to talk a little bit about that as well. I'm also faculty at Nova. I have students who shadow me in the office, which is very important because only maybe 15% of medical schools are teaching anything about the endocannabinoid system or about cannabis medicine. So the residents and students get an opportunity to see how on a daily basis I'm using this with patients and how the outcomes are, which is important. I have palliative care fellows who are graduating who really have no idea about how to use cannabis, and that's an area I have a lot of interest in, is end of life care. I just want to start off by saying that sometimes with cannabis, people think that it's personalized medicine, and it's very based on the individual, based on their previous experience with THC, their medical condition, their goals. And a lot of times my job is really to educate them, to get rid of the stigma, to educate other physicians and their families as well, and then to empower the patients to participate in their own healthcare. And I think that's really important because we've gotten to the point where we look for the physician to give us the answer. And now people are starting to really question the physician's answers. And so using cannabis allows the patient to become an active participant in their healthcare, make better lifestyle choices. And I also get to see a lot of the challenging cases where Western medicine has failed. We don't have a proper cause for the patient's symptoms. And then it goes back to health promotion and disease prevention. So I'm going to talk about the endocannabinoid system, which, if we optimize that, we can really prevent chronic disease and cultivate health, which is really important, especially these days. So oftentimes we use cannabis as a crutch initially. So someone can't sleep, they're having pain. You know, when someone breaks their leg, for example, we use a crutch. The crutch is there just to kind of get them through until the process of healing can terminate. And so really cannabis can be used as a crutch, but with time, over time, we start to actually have healing in the body. And that process really has to do with the fact that we optimize our endocannabinoid system, we become more resilient to stress, and we can do this in a targeted manner, which means that we can personalize the medication. Sometimes we need more, sometimes we need less. Over time, someone who's taking cannabis on a daily basis can actually decrease their levels over time. So it's okay to use something as a crutch, but we like to call it harm reduction. We're using one substance as a substitute for another. Cannabis happens to be extremely non-toxic. There's no lethal dose, and therefore it's something that is better than, let's say, pharmaceuticals like sleep meds or anti-anxiety medications, opioids. And there's this huge substitution effect, even with alcohol. Many people are actually self-medicating with alcohol for stress. A lot of Parkinson's patients can't fall asleep. They use it for their tremors, for anxiety. Even, mothers are starting to drink one glass of wine that turns into a bottle of wine by the time it's 5 o'clock. So cannabis really is what we like to say harm reduction. It's a safer substitute. And then the other concept that I want to just start you off with is really that there's so many medical benefits to cannabis, but there is an extremely powerful therapeutic component in terms of the capacity to alter our consciousness. A lot of times, the way that we perceive our pain, for example, or our chronic condition is in our consciousness. And cannabis, once you're using it for symptom management, once you feel better, once you understand the plant, you can use cannabis and not be scared of the potential for the high. And the high doesn't have to be something dangerous. It's not the goal, but sometimes it allows us to kind of connect with ourselves or connect with our disease or our symptom, understand that we're more than just our disease. A lot of times patients are given a diagnosis, and this really plays into their psyche. It plays into their physiology. The fact that they say, well, now I have diabetes, it's almost like a sentence for them, as opposed to giving them an option that potentially we can reverse this. We can change the way we view ourselves, change the way we look at our disease process, and then also connect with others and nature. And so this new perspective plays into neuroplasticity, and that's an amazing factor that cannabis can actually cause neuroplasticity, increase the neural circuitry that we have, cause synaptogenesis, where we're building these new synapses, which is important in the future to prevent conditions and a lot of chronic debilitating diseases. So cannabis is more than just a plant that people smoke that has THC in it that they get high, obviously. It's now legal for medical purposes in many states, more so after the recent election. There's also more states that have adult use cannabis, or what you refer to as recreational. So the actual plant has over 400 components. There's cannabinoids like THC and CBD. There's other cannabinoids like CBN, which we use for sleep, CBG for anxiety, and then terpenes. Terpenes are, again, what gives a plant its smell, its flavor, and what guides the effect. So sometimes people say they use cannabis, they become anxious, they become hyper. That's a specific terpene profile for that strain. Sometimes they become tired or sleepy. That's another terpene profile. So we can really personalize it by picking the terpene profile and the right amount of CBD and THC in the right ratio in milligrams. So the complexity of it allows for so many different variables, which is good. And at the same time, it makes it difficult initially starting off for a cannabis naive patient. Well, which product do I buy? How much do I use for this condition versus that condition? So I'm going to really go into how we personalize that. The terpenes and the cannabinoids work together, what we call it the entourage effect. The entourage effect means that synergistically, all of these properties of the plant have a benefit much more than if they were an isolate on their own. So people take CBD in an isolate form. That, first of all, doesn't activate our endocannabinoid system. And second of all, you would need a higher milligrams or more volume, for example, to get to the same desired effect than if you were to add terpenes or potentially a little bit of THC. The terpenes alone have benefits. For example, linalool. Linalool is found in lavender, which is very sedating, and we use linalool as an essential oil. Same thing with myrcene. Myrcene is also something that we would say is more of an indica leaning terpene. Limonene, on the other hand, as it sounds, is more citrusy. It's something that can be more uplifting, cause alertness. These are more sativa. And these are types of differences between cannabis. And the old nomenclature is sativa versus indica, the types of plants, the way that they're grown, the way that they look, but it's also the terpene profile in it. So it's not just using THC to fall asleep, it's using THC with a little bit of myrcene, for example, for sleep or for pain. And then beta caryophyllene is a great anti-inflammatory. It's found in black pepper. It actually activates our CB2 receptor. So it activates our endocannabinoid system, and it's a form of the terpenes in the cannabis plant. So we can actually personalize people's medicine by their condition. So if someone had inflammation, we can use CBD with beta caryophyllene, and we don't have to just rely on the THC. Is the main point. The terpenes will help us limit the dose of THC, and THC has the intoxicating effect. It's what gives a stigma to the plant. So we all have an endocannabinoid system. They discovered this in the early 90s. They actually discovered that THC in 1964, and that actually activates our CB1 receptors. And as you can see, the CB1 receptors are found in our central nervous system, our brain and our spine. And so when you use THC, it can cause properties of the central nervous system. It could increase appetite, decrease nausea and vomiting, treat pain, help with sleep. CBD, on the other hand, you see it doesn't actually activate any of the receptors. And so when they discovered we had an endocannabinoid system, they thought, well, we have these receptors all throughout our body. Is it just to be activated by the cannabis plant? And then they discovered we actually have a molecule in our body that's structurally similar to THC. They called it anandamide, which means the bliss molecule. And the purpose of the endocannabinoid system is to keep us in balance or maintain homeostasis. So we make these endocannabinoids on demand, and then they're broken down by certain enzymes, and then they activate our receptors, and they're supposed to keep all of our neurotransmitters in balance. But sometimes we have stress, we have trauma, we take medication, there's certain toxins, and this will affect our endocannabinoid system. The difficult thing is we don't know how to measure our endogenous cannabinoid levels at this time, and we don't measure our cannabinoid receptors at this time. So we try to minimize insult to the endocannabinoid system, which is like alcohol, cigarettes. We try to eat healthy, of course, but sometimes we need to supplement with the cannabis plant. Now, if you just take CBD alone, it doesn't activate these receptors, but it breaks down the enzyme. It inhibits the enzyme that breaks down our naturally occurring cannabinoids. So by taking CBD, we increase the amount of anandamide that we have in our body, which is a very good thing. But it's an indirect modulator. It doesn't actually activate the receptors. So a lot of times when we're taking CBD for stress or for inflammation, we need a small amount of THC to get the endocannabinoid system going. And so you see that the CB2 receptors are in the abdomen and the periphery. This is more for inflammation and the immune system. In Florida, we have 10 qualifying conditions in order to get a medical card. A patient would see a physician who has taken the CME course and is able to certify patients. It's a regular history and physical exam. A lot of times we ask for medical records. And some of the conditions that would qualify would be cancer, epilepsy, glaucoma, HIV, AIDS, PTSD, ALS, Crohn's, Parkinson's, or MS. Now, most of the people, probably 2/3 of the people, have chronic pain. Chronic pain is not a qualifying condition. Then after chronic pain, it would be anxiety, depression, and insomnia. So none of those are actually qualifying conditions. However, if you see number 11, it says medical conditions of the same kind or class or comparable to 1 through 10. So what that means is if someone has anxiety, that's similar to PTSD, and they would qualify. Or someone has ulcerative colitis, that's similar to Crohn's disease, so they would qualify. It just takes a little extra paperwork, but the nice thing in Florida is that we actually have the ability to have the same kind or class. Other states have their own specific conditions. So the question is, why use medical marijuana? Oftentimes, people say that, well, the medications I'm taking are causing side effects, or I want to have a more natural option. And so there's different reasons why someone would consider using medical marijuana. One of the biggest issues is cost. So because it's a Schedule 1 drug, it's federally illegal, it's not covered by insurance. The physicians can't accept insurance to see the patients because we can't write on the medical records that are submitted to the insurance about a federally illegal substance. So even though it's legal for medical purposes in the state of Florida, it's still federally illegal. So the main reasons again would be chronic pain. And I want to specifically talk about fibromyalgia. That's what we call an endocannabinoid deficiency syndrome. And so what that means is that this population doesn't make enough of their naturally occurring cannabinoids, so they can't keep their endocannabinoid system in balance. And this is similar for chronic fatigue, IBS, chronic migraines. All of these conditions don't have any pathology or objective findings. And they did a survey looking at 1,300 fibromyalgia patients, and about 60% reported that cannabis was very effective, as opposed to the 3 other FDA-approved medications, Lyrica, Savella, Cymbalta, which were not effective. So this is a population I see often. They have depression, they have pain, they have problems with sleep, and cannabis can help all of that, as well as increase their endogenous cannabinoids to actually treat the deficiency. So that's a population I do see often. And I also find that I used to be frustrated, and now that with that population, as they were, because there was no good treatment. And now a lot of times the patient's able to take cannabis and then over time decrease the amount of cannabis they're taking. It's also a great anti-inflammatory, not just for things like arthritis in the joints, but also we have inflammation throughout our body. If someone's dealing with depression or dementia, there's inflammation in their central nervous system or in their enteric nervous system, their gut. And, we know a lot about the gut brain axis as well. And we also use it for muscle spasms and neuropathic pain. It's great for things like peripheral neuropathy, sciatica, where you have that numbness, tingling, burning type of pain, as well as for spasticity and muscle spasms. So what we've seen is that there's been a 25% reduction in opioid overdose fatalities in a medical legal state, which is interesting because the United States has uses 80% of the world's opioids. Even though we're 5% of the population, we use 80% of the world's opioids. Other countries don't have access to opioids. Most people who enter drug addiction centers were first given a prescription for an opioid from a physician. It only takes a week to become physiologically dependent on these medications. They have horrible withdrawal effects and life-threatening withdrawal effects as well. And they also can cause respiratory suppression. Cannabis, the cannabinoid receptors are not in our brainstem, so there is no chance of overdose. So that's why, whether it's a young patient, an old patient, we talk about obviously risk of falls, but there's no chance of overdose with cannabis. Now, we have to differentiate between CBD that comes from hemp and then medical marijuana. In order, again, to get a medical marijuana card, you have to see a physician, have a history and physical exam where you'll get education and an idea of an algorithm of where to start with what products and how to dose and what route to use. Hemp oil, it can be bought anywhere in the United States or online. Now in Florida, our commissioner, Nikki Fried, has made it known that everyone who sells CBD has to actually have a permit through the Department of Agriculture. This means that everything is lab tested. That's extremely important to make sure that we're not consuming any type of cannabis that may have mold, pesticides, um, and also has the right amount of CBD, which means that if you buy a bottle that says 1,000 milligrams of CBD, it should have 1,000 milligrams of CBD. There was a study done that showed that more than 2/3 of CBD that was sold in the United States had had a false amount based on a lab test, meaning most of them had less CBD or too much THC. And that's important because the THC, again, is the intoxicating cannabinoid. And so in CBD hemp oil, there should be less than 0.3%, which means if you're using CBD, there should be no chance of the high. So besides lab testing, there's all different ways of extracting hemp, and the quality of the product is very important. But most of the time, I'll see a patient who says, I've already tried CBD, so I need cannabis. A lot of times they have no idea the dose they've taken. Maybe they said they've taken 5 drops, but to me, 5 drops of what? Is it 5 drops of 1,000 milligram tincture? Is it a good quality product? And so I don't really use drops. I'll look at the dropper and understand how many milligrams they're taking. And usually I'll start between 10 and 15 milligrams, and every 2 or 3 days I'll increase by 5 milligrams. And that's for CBD. It's just a general rule of thumb. It's easy for patients to understand and easy for them to understand the fact that they should be consistent with it every day. It's good. It's also important to understand the difference between CBD and THC, since those are the two prominent cannabinoids, the ones that are mainly used in the medical dispensaries. So again, CBD doesn't bind to the receptors, and the nice thing about CBD is it's one of the only things that can actually decrease the psychoactive effects of THC. So it's called a negative allosteric modulator. What that means is that it kind of turns down the volume. Let's say if you're using THC, it still gives you the effects, but not as strong. And so it actually changes the shape. And so there will be a lot of people who need the CBD just for the reason of mitigating the intoxicating effects because they need to use THC. It's great for inflammation, for anxiety, for pain. And then THC, we use it again for more central nervous system things, to help patients with cancer, who may be suffering from, let's say, neuropathy from their chemo, having issues with appetite, nausea, pain, or sleep. So there's all different ways of using cannabis. So the first the first route that I like to use for most patients is a tincture. Now, a tincture would be a bottle of oil that could have CBD, THC, or any ratio of the two. But the nice thing about a tincture is you see that the dropper has little markers on it. So it'll tell you 0.25 milliliters, zero point 0.5 milliliters, all the way up to 1 milliliter. And it'll also tell you the milligrams per milliliter. So let's say it's a 10 milligram per 1 milliliter. If you take 0.25 milliliters, that's 2.5 milligrams. The nice thing again about the tincture is it's flexible. You can start off with 2.5, you can increase by 1 or 2 milligrams every few days if it's THC, as opposed to a capsule or vaping or smoking where you really don't know the milligrams. And then there's also capsules and edibles. These will take longer time to take effect. And besides having a longer onset, it's also going to last longer in the system. So people who use these, good ideas, let's say if you want to sleep through the night, an hour before bed, you take a capsule, and within an hour it kicks in and it lasts a good 6 to 8 hours. Tinctures usually, because it's fat soluble, we say to try to eat with it like a fat or an oil so that it's metabolized faster. And then there's different ways of the inhalation route. So there you can either vape something, or smoke flower. Vaping, again, it's the same thing. You really have no idea. If you just get a pen, for example, you have to know what is in it. What's the oil that's in your pen? You have no, you have to understand that it's not just a okay, I use my pen. There's many different vape cartridges and all different ratios and terpene profiles. So the issue with the vaping epidemic came up because they added something called vitamin E acetate, which is an additive that caused lipoid pneumonia because we shouldn't be inhaling a fat soluble vitamin. That was all black market stuff. Everything in the dispensaries are lab tested. So the oil in the vape is nice because it's also very convenient for people. They don't have to light anything. It's the fastest way of feeling the effects. If you use the inhalation route, it goes right into your lungs, into your bloodstream. So vaping is an option for a lot of people who need fast acting relief from pain. Maybe they feel anxious, maybe they want to fall asleep quickly. That's a fast route, as opposed to, let's say, a transdermal patch. The patches are systemic. You could put them on your wrist, you could put them on your ankle where your blood supply is most superficial, or you could put them on the area that you have pain. They'll last 12 hours. And the bioavailability is much lower in a transdermal patch, so you're not going to feel any of the intoxicating effects. Now, flower, again, has all the cannabinoids, all the terpenes as it was made. And so it has the entourage effect. You can smoke flower or you can vape flower by putting it into a vaporizer that controls the temperature so that it's subcombustible, not allowing carcinogens into the lungs. Um, a lot of times people who have been smoking marijuana for a long time like this, and it's difficult for them to understand that they should be, use a tincture or a capsule to treat something more chronic and long acting. But flower does have the most benefit because of the entourage effect. Now, when we dose patients, we talk about personalized medicine. First, we choose the route of administration. Some people don't like the taste of the oil. They prefer a capsule. The problem with the capsules is, again, it's 1 milligram. It's 10 milligrams, 25 milligrams. There's no flexibility there. Some people just like vaping and smoking because they want to not dose themselves. They just want to feel the effects quickly and they don't want it to last long. But we try to talk to people about treating short versus long-term conditions. Let's say chronic pain versus acute pain, chronic anxiety versus a panic attack. So using a tincture is nice because you get a longer acting effect, and again you have the flexibility. So we start low and increase it slowly. It's nice to be consistent before we make any changes. And then we like to look at the ratio. If it's a cannabis naive patient, then we don't want them to use THC alone. And maybe even a 1-to-1 ratio would cause a potential high. So we can use a 3-to-1 ratio or a 5-to-1 ratio where the CBD is higher than the THC to mitigate any of the psychoactivity. Usually as we increase the dose, the patient feels better, and then we get to their sweet spot, which is where that ratio and that milligram is effective. And then with cannabis, more is not better. As we use more THC, we can feel anxious, we can feel sleepy. So it's important to understand where that sweet spot is, and it's really not necessary to use more. And then again, there's sativa versus indica. Sativas are more for daytime, indicas are more for pain, for relaxation. And then there's hybrids, which is a combination of the two. So a lot of times patients who have pain don't use sativas because they can actually heighten your nervous system. And so a daytime medication for a pain patient would be more of a hybrid. For people who need to sleep or want to relax at night, the mnemonic for indica is in the couch. It's more sedating. And seniors are also using cannabis probably more than any other population. And that increase has come really from the fact that there's, again, no risk of fatal overdose, and the fact that they've tried and failed so many other options. They have so many side effects from different medications. And as we age, our naturally occurring cannabinoid levels decrease. And that's why we have chronic disease as we get older. When we're young, we're healthy, our endocannabinoid system is in its optimal state. And then through time, through aging, through many other factors, we make less of these naturally occurring cannabinoids, which can actually cause chronic disease. So a way to prevent chronic disease is taking CBD, using cannabis, eating healthy, exercise, different supplements to enhance our endocannabinoids that are made on demand. So I will mention that in the literature, it says that there's a 9% rate of addiction for cannabis. This is usually because people are arrested with cannabis, and because of that, this is an overinflated number. They're sent to some type of addiction, facility. It's really more of a dependence. They use it because they feel better. They use it because they like who they are when they're using it. And then also it can help with decreased cravings and help with withdrawal. But like any other medication, if you're using this on a daily basis, you can build tolerance to it. So there is something called cannabis use disorder or abuse disorder where they're overusing cannabis. And this is a problem because the same way we don't make enough endocannabinoids, we can actually overstimulate or oversaturate our cannabinoid receptors to the point where people are just using high percentages of THC too often, and they're not going to get the effects. So there's been some research done showing that even taking a holiday for at least 48 hours can reset the endocannabinoid system. And then when patients start back, they're supposed to start around 50% of the level that they were at because the desensitization. So again, it's really about harm reduction. It's about using a safer substance for treating a specific condition. And again, cannabis has a much safer safety profile. So in general, I again stress optimizing our endocannabinoid system, understanding that it's personalized medicine. Sometimes it may take a few days, a few weeks, a few months to get to the exact right ratio and dose. It's really understanding the plant and how it affects the individual. And, it's really also what we like to say an exit drug, not a gateway drug. People who use cannabis on the black market, they have the option of buying it from someone who can offer them other things. When you go to a dispensary, you're basically getting a form of cannabis. So in the future, there'll probably be much more research that has to do with not just CBD and THC and different routes of administration and milligrams, but looking at how it affects the receptors, how it affects the enzymes. And the difficult thing is that even big pharma, it's tough to let's say pick a specific condition like neuropathic pain and say, well, in terms of a pharmaceutical, let's use 10 milligrams of a 1-to-1 capsule to treat nerve pain. The problem is that maybe someone's been using cannabis for their entire life, and that 1-to-1 is not really going to touch their pain now. Or maybe 10 milligrams of a 1-to-1 is way too strong for someone and they're going to feel intoxicated. So it's very difficult to do standardized trials to make specific milligrams and ratios per condition because it's individualized. So it really goes against the way that we've always practiced medicine, because we have to be comfortable allowing the patient to explore and understand how it affects them, obviously with some guidelines. So I'll end with this, which says, no matter how much it gets abused, the body can restore balance. The first rule is to stop interfering with nature. Oftentimes, we have the innate wisdom within ourselves to understand what's best for us. And I think that now is a great time more than ever, especially during this pandemic, to try to connect with ourselves, to try to make lifestyle choices that are healthier and also practice harm reduction. If anyone has questions, I can definitely answer that.
Hi, yeah, that was a great presentation, Michelle, thank you. I'm wearing the mask because there's someone in the room with me now, so I want to be safe. So there are a couple of comments and questions in the chat box, but if you have any questions, please add them into the chat box. Someone asked if this presentation will be available later. Yes, it will. And there's a comment from someone who's in Ohio, actually. We have 21 qualifying conditions, including chronic pain, but don't have an 11 like Florida that generalizes other conditions. So we have nothing to cover depression, anxiety, etc.
That's unbelievable. I mean, that's like the fact that we don't have chronic pain as a standalone condition. Really, that's what we're pushing for. But it's difficult to make these changes. But especially, after the pandemic and the fact that we're seeing so much information about how cannabis can help with stress, and the fact that they actually deemed cannabis essential during the pandemic, and the dispensary stayed open, which really goes to show how that is something that we definitely need for mental health. I find that unbelievable that Ohio doesn't have anything that covers depression or anxiety. I mean, we have PTSD and we don't have anxiety and depression, but we can get the anxiety and depression conditions covered because it's similar to PTSD.
Right. Michelle, can you share um, a case, obviously anonymously, of a patient that you had been seeing who was addicted to their pain pills and you were able to help transition them off of those pills?
Sure. So that's like my bread and butter. But I actually have a physician who was on opioids. He was on Percocet, probably 3 to 4 Percocet a day for foot and ankle pain. And this was a gentleman who was retired, and he didn't want to be on these medications, but he had no other options. And this was probably 2 years ago. And he was really, a physician who understood that, who didn't understand cannabis very well, but he just understood that he was miserable on these medications for the amount of side effects that he had. So the way that I usually treat chronic pain and opioid patients is I try to figure out how much of a tincture of a 1-to-1 they need to not take their pain medication. Oftentimes the CBD is not enough to be a substitute for an opioid, and so I will start off with, let's say, 5 milligrams of the 1-to-1 tincture. We'll pick one time a day that they won't take their Percocet, and then see if that's enough. If that leads to pain relief, then they'll continue on 5 milligrams of the 1-to-1 twice a day. If it doesn't, we'll increase the dose by 1 or 2 milligrams every 2 or 3 days until they find relief. So he was a guy who ended up taking about 5 milligrams of the 1-to-1 2 times a day with breakfast and dinner. And then eventually I got him to understand that, this is a plant that the negative, what's looked at as an adverse effect, is the high. And so for him, he was at the point where he was frustrated with his pain. He was retired now. So then I actually encouraged him to use a little bit of an indica THC at night without CBD, so that he would understand what it can potentially do for his mental health and for his sleep. And so this guy now, he uses 5 milligrams of the 1-to-1 twice a day, and now he'll even smoke flower at night, because it's opened up his mind and really helped him to integrate cannabis into his daily life. And a lot of times they'll make other choices that are better in terms of nutrition and movement once they start using the plant. So it's a nice story, because he's a physician who was so into the stigma and not understanding what it could do, and now he's such an advocate, which is really great to see.
Wonderful. Are there any other questions? You can quickly put them in the chat box. If not, Michelle, Dr. Weiner, thank you so much for this great presentation.
Sure.
Actually, our friend from Ohio said she's been working in a dispensary up there, and she learned more from you here today than she has in the years of working in a dispensary in Ohio. So thank you very much for your time. And now you can go spend time with your wife and children.
Thank you. Thank you so much.
Michelle.
Okay. Bye-bye. Thanks for having me.
And now we're going to switch over to, I'm alone in the office now. We're going to switch over to Stacia Smith, who works for Liberty Health Sciences, which is a dispensary in Florida. And she's going to give us a tour of the dispensary and show us around with some products, and then also tell us how we can get our medical marijuana card. So I am joined by Stacia here. who is going to unmute. She's actually in the lobby, so you might hear some patients. So Stacia, thank you for joining us, and take it away.
Great. Well, thank you so much. As Cindy mentioned, my name is Stacia Smith, and I am the Community Outreach Specialist for Liberty Health Sciences, and I cover the lower third of Florida. So I have the opportunity to support 10 of our dispensaries currently, and I get to visit with lots of different doctors and patients, just talking about medical cannabis, the different ways that medical cannabis can benefit patients, and some of the options that are available to patients. Liberty Health Sciences, we're one of 22 license holders in the state at this time. So we have 26 dispensing locations in the state of Florida. I think most of our viewers are probably from the South Florida area. In South Florida, we have a dispensary in Boca Raton. We have one in Dania Beach. We have one in North Miami, where I am today. We also have one in Bird Road, and we are open every day. Cindy? Thank you. We're open every day, and prior to COVID, our dispensaries are called cannabis education centers. Why? Because even if you're not a patient, we're really just trying to help people understand about medical cannabis and to see that this is a very legal program regulated by the state of Florida, and it's a really wonderful medicinal option for many patients to incorporate into their care plan in conjunction with their doctors. So today, I'm just going to talk to you a little bit about Liberty, about the process of becoming a patient, and what it would be like to actually come to the dispensary to get medicine once you have your card. You'll probably hear some voices in the background. We are open until 7 during the week, and so we actually have a couple of patients here in the lobby right now. I would love the opportunity to introduce you to our team members, but they are currently helping patients. We'll see if they free up in a little bit. Again, I cover the lower third of the state, and I wanted to say that with Liberty Health Sciences and with all of the medical cannabis dispensaries in the state of Florida, we are vertically integrated. What does that mean? That means that from seed to sale, we have stewardship over every single piece of the process. And the reason the Department of Health designed the program to be like this is because they wanted to ensure that the medicine would be very, very safe when it gets in the hands of the patients. We are dealing with all kinds of patients across the spectrum. I think at this time, the youngest patient I'm working with is probably like 8 years old. And we also have patients into their 90s. So we're dealing with children, we're dealing with immunocompromised folks, geriatric patients, the whole spectrum. So we're really wanting to make sure that whatever medicine people are getting, it's very safe and has been tested internally by our team, by a third party, as well as by the Department of Health. So what we'll do now is we're going to walk through our lobby just so you can kind of get a little overview of it. And we're going to go into one of our consultation rooms. This would be a room that patients would come into if they come into the dispensary and have some questions. We would have one of our team members sit down with you and talk to you about the different medical options that would be available to you. So we'll just give you a little bit of a tour just to show you what it looks like in here. It's just like kind of like if you were going to go into a pharmacy. You're going to walk in, you're going to see different options here. We've got counters that show the different kinds of medicine. This, for instance, is one of our counters that's talking about topical. Topical is one of the routes that we have. We also have over here oral. So this will be some of the oral options that we have. Over here, we have inhalation. So these are some of the inhalation routes that we have available. And up here is what we have our counter and our menus. So we'll come back out here when there aren't any patients. And for right now, we'll go into a consultation room where I can talk to you about, Cindy is back here, right here. So we're going to go into one of the consultations rooms so I can talk to you further about the different products that are available. Okay, so we wanted to just talk to you about the process of becoming a patient. Dr. Weiner highlighted and touched on the different qualifying conditions. I would suggest going, if you're interested in learning more, to the website is knowthefactsmmj.com, or you can just Google Office of Medical Marijuana Use. In the state of Florida, it's called the OMMU, and that's going to have a list of all of the dispensaries that have the licenses within the state of Florida to dispense the medication, as well as all of the doctors that have taken the CME course to be able to recommend patients to become a medical cannabis patient. And it's also going to have just a lot of information about the process of becoming a patient. So basically, once you see a doctor like Dr. Weiner and she ascertains that you have a qualifying condition and that would benefit from incorporating medical cannabis into your plan of care, the doctor makes a recommendation. and they fill out some paperwork on the OMMU website. Then you as a patient, and those to visit the doctor for that usually is the range in South Florida is between $150 to $250. I will tell you that price has come down quite a bit. When we started with this program a few years ago, there were some doctors on South Beach. I had one that was even charging $450. So it's going to come down the price, I think, a little bit more and more as the program continues to grow and as we continue to see the patient numbers go up. Right now, we have about 350,000 patients in the state of Florida, and we do anticipate that number to go up quite a bit. As Dr. Weiner alluded to, cannabis was deemed essential during the pandemic. And so what that meant is that we did not close down, not even one day during the pandemic. We certainly had to change our philosophy regarding some things. We now are only permitted to allow patients into the dispensary as opposed just to allowing anybody in off the street. I used to do a lot of programming in the dispensaries, like yoga classes and lectures and things of that. We really wanted people to come in, and we hope we'll get back to that time. But at this time, to be safe with our patients, we are only allowing patients in. So at any rate, once you see your doctor and they make the qualifying condition, you will then fill out your application online with the OMMU. The fee for doing that is $75. There's like a $2 convenience fee to do it online. So you're looking at $77, and this is a license that will last you a year. Also important to note is that the recommendation from the doctors can range anywhere from 3 months to 7 months. Most of the doctors, like Dr. Weiner, will give you the full 7 months, unless your medical condition would require you to come more often than that for follow-ups. So it's up to the physician, but they can extend you up to 7 months if they choose to do so. You, within 10 days, will get an email from the state of Florida with your patient number. And once you have that number, you can come to the dispensary and shop for your medicine. You will receive a card that looks just very much like your driver's license card. It will have your picture on it. And what you'll do before you receive that card is when you come to the dispensary, just make sure you have your driver's license or a photo ID to show. And then you can come shopping. So that's the next thing we'll talk about. Also, I'll tell you that, so our dispensaries are open 7 days a week. We're from 10 to 7, Monday to Friday. On Saturdays, we're from 10 to 5, and on Sundays, we're from 12 to 5. We also do delivery in the state, every county except for maybe 1 or 2 in the Panhandle. But down here in South Florida, we do delivery 4 days a week, and you have to place a $100 order to qualify for free delivery. Important to know that at this time, only cash is accepted at the dispensary. So we do have an ATM in the dispensary, or you'll want to bring money with you. There is an app called CanPay, CANPAY, and you can download that and also pay that way. But we do not accept credit cards or any other form of payment at this time due to the federal legislation surrounding medical marijuana. Most of the banks won't allow us to do that. We also have a platform that's really helpful on our website. I would encourage you to check out our website. It's libertyhealthsciences.com. On our website, you can see a tour of our grow, which is in Gainesville, Florida. We have a very large growing facility up there with some of the best and brightest working on the cultivation side, as well as on the extraction side, making sure that every single, from the time that that seed goes into the ground to the time that the medicine goes into your hands, that everything has been taken care of properly, from the composition of the soil to what's being sprayed on the plants, to how the plants are being fertilized, to the times that they're being harvested, how the flower is cured, all the extraction. We use CO2 extraction as well as ethanol extraction. We also do distillation. So we do a variety of things to ensure the quality and the purity of medicine. We have a platform called iHeartJane on our website. With that platform, you can reserve your products for pickup that same day or schedule it for delivery. Delivery, you can typically have between 24 and 48 hours, depending on the volume any particular week. And with iHeartJane, it's really nice because you get to see the live inventory in each dispensary location. One of the things, as Dr. Weiner also alluded to, is that this is plant-based medicine. So this is not really like a pharmacy. We do work very closely with Mother Nature to produce these plants and have them grow according to the cycles that will help us have medicine available when patients need it. But we will see, and you will see at any dispensary, an ebb and flow in inventory levels, depending upon the plant cycles and the growing cycles. We may have a lot more flower one week and a lot more tincture another week. It really just depends on the plants. We do try to always have a very wide variety of options for patients. And so now I'm going to talk a little bit more about the products we have and show you some of the samples. All right, so when we talk about medical cannabis, we have the first thing we can talk about is oral. And when we look at oral, we have, that's going to be either an oral solution or a tincture. That term is used interchangeably. We have options starting with just very high quality cannabis-derived CBD, so there's no psychoactivity there whatsoever. And then we start with ratioed products, and we have ratioed products starting at 30 parts CBD to 1 part THC, and going all the way to 1:1, so it'd be like half CBD and half THC, to products that are maybe like 1 part CBD to 3 parts THC if a patient's going to need something stronger. Again, remember the THC is a psychoactive component of the plant, and that is what is going to assist some patients with pain relief, seizure control, things of that nature. But with medical cannabis, you always, the motto is you want to start low and go slow and really microdose to find the sweet spot of exactly how much you need. Most patients are not looking for that head high. They are looking for ways to just manage their symptoms, to mitigate whatever disease state they are dealing with, and to be able to live as functional and effective as a life as they can, and not have any head high. So for patients that need the stronger products, we definitely have that available, but we really are looking at a lot of different options for people. We also, one of the things when you come into the dispensary is we have all kinds of educational materials, which you can always, if you are not a patient, you want to come by and pick up some materials, you can always call and come out and they'll bring the stuff out to the door for you. But this is one thing, is like our healing chart. It'll show a little bit about medical cannabis and all the different things that the plant can assist with. And then we have here the strain selection guide. All this information is on our website at libertyhealthsciences.com if you would like to check that out. But again, as Dr. Weiner alluded to, we have sativa and indica are the two main types of strains that we start with. So with sativa, it's going to be much more energizing and uplifting, and the indica is going to be much more relaxing and sedating. So, and then we'll have hybrids that have like a mix of both. So within all of our formulations, you're going to be able to see exactly what's in the medicine. Every product is barcoded with that links to a certificate of analysis, so that you can see exactly what's in the medicine and know and have that confidence that what you're consuming is a very safe product. Again, so within the orals, we have CBD, we have a bunch of different ratio tinctures. We also have distillates, which are going to be very strong, very concentrated products. This would be for patients that maybe have incredible pain or very strong symptoms that they're trying to control, or sometimes patients also might have a very high THC tolerance. It is very surprising. Some people are extremely sensitive to THC. I'm an individual like that, very, very sensitive, and some people have a very high tolerance and actually have to take quite a bit more of the medicine to take care of the same kind of symptoms than somebody else would. So you will have to count on the fact that you're going to have to play with this a little bit once you start as a patient and experiment to see what's going to work best for you. Medical cannabis is a very individualized medicine. With our distillates, one thing that's really nice is that they're decarboxylized. What does that mean? That means that they are safe to cook with. So you can actually, if you're wanting to make your own edibles at home, if you wanted to make brownies or put them into sauces, the distillates are very good for that. We also have topicals, which are very good for patients that are dealing with either spot-specific pain. So you have like, a balm that you can put on your hands or your joints. And those, again, will come in a variety of ratios from, high CBD and low THC to very high THC and low CBD. So we will have an option of those, a variety of things. One of the companies that we work with, Liberty Health Sciences, is kind of like what I call like a medical cannabis department store. We will always have a lot of options. And one of our partners is Mary's Medicinals. This is a very good company out of Colorado. And so we actually have their employees working at our farm, overseeing their portion of the grow and their So their cultivation, their extraction, they do all of their own packaging. But Mary's is one of the first ones that came to market with transdermal products. So they have these transdermal patches that are really, really fabulous. They go on to a venous part of the body, usually inside the wrists, and they can provide 8 to 10 hours of relief. Those come again in like a CBD, a 1-to-1, or either a straight sativa or a straight indica. But people really do like those. They're very easy to travel with. They're very discreet. They also have a transdermal compound that goes right on, between either the wrists or behind the knees. And the thing with the transdermal products is that they are 95% bioavailable, and they are fully systemic. So they go into the bloodstream, and 50% of the medication is dispensed within the first hour. And then the rest of it is like a slow release tablet, almost like, if you will, where it's dispensed into the bloodstream over several hours. Some of the other products we have are, there's a new line we have called Lemon and Grass, which is a really lovely line people like, that has tinctures, capsules, and the bombs. With the capsules, one of the things to remember when you're taking a capsule, you're always going to think of, with any medicine that you take, the length of time it will take for onset to occur. So the quickest acting is typically the vaping products. Usually within taking a hit off of a vaping product, you're going to feel results within about 15 minutes. Sometimes a little sooner, it depends, each person's a little bit different. If you take a capsule, it has to go through first pass in your liver, and so sometimes it can take some people an hour to 2 hours to feel that. So it really depends on how quickly you're wanting to feel the effects and how long you need them to last for. With the sublingual tinctures or the oral solutions, you put them under the tongue, and you will typically feel those within about 20 minutes. Liberty is known very well in the industry for our flower products. We have a variety of flower options for patients. We're always trying to keep the price very accessible. At this time, none of these products are covered by insurance, and we're really aware of that. So we always want to offer sales. We usually do about 3 sales a week. And the point of this is we're really trying to make sure that patients can afford the medicine to the very best extent that they can, since we don't have the ability to do insurance at this time. We also, with our vaping products, we have a variety of options. And I don't know, Cindy, do you want to put, I was going to take them back here to this shelf to show them some of the options. Here we go. This is a little bit of like a little shelf here, if you will, but this is an example of one of our oral solutions. So it would come like this, and it's just going to look like this, and you open it up, and it's got, the measured capsule thing here, so you can figure out exactly what you need. These are example of some of the Mary's medicinals patches. And, again, we have a lot of this information on our website as well. This is the Lemon and Grass line I talked about that has some of the different relief bombs. And also with the Mary's medicinals, this is a really great product. This is called a transdermal gel pen. So you do 1 pump, it's a 1 pump dose, and you put it right in between your wrist. This is a great product as well. For our vaping, we have so many different vaping lines that are really, really good. This is one that people really love, this Pretty Pistols line. These are disposable vapes, so they'll probably have about 40 hits in them. And they come in ratios of, there's like a 10 CBD to 1 THC. There's a 1-to-1 that people really like, and then there's like a 1-to-3. So we really are wanting to make sure that from the cannabis naive patient who's never tried cannabis before to those that may be much more of an experienced user, that we have something for everybody here. Also, we have one thing that's very interesting is we have these new flower vaporizers. So you can actually take your flower and grind it and put it right into this device and vape it like that. This came really popular during the vaping crisis that Dr. Weiner mentioned, but important to know with all of our products, you can always link to the certificate of analysis, and you'll always want to ask any dispensary that you go to, you want to see that certificate of analysis. You want to know that that testing's been done, so that you know the medicine that you're taking is as safe as possible. The other thing I was going to mention is this PAX pen line. Hacks is a really incredible brand if you're going to go for a vaping product. And one of the things I really like about it is that they have put so much functionality into this to make it really easy for patients to understand exactly what they're doing. So you can control the temperature setting. If it's lower temperature, you're going to have more flavor. If it's higher temperature, you're going to have more vapor. You can control the draw settings. You can have micro, small, medium, and large. You can link to the certificate of analysis right off of your smartphone with this device. You just download the app, and you can also see the lineage of the plant and the terpene profiles and things of that nature. So it gives you a lot of information. So a lot of these companies are really just trying to empower the patient to know as much about the medicine that they're taking as they can. And I think that's pretty much all I have to say for today. The one thing I would tell you is, here, I'll show you this here. For any patient that comes to Liberty Health Sciences, we have a discount program. So you're going to get $75 off your first order of 150 or more. So that's a really good incentive. And a lot of the dispensaries will do first-time patient discounts. So, this is the one that we do, which is one of the better ones in the industry. I'll also tell you that for veterans, we always do a 25% discount for veterans. And we also do a 15% compassionate discount for those folks that are on like some kind of federal assistance program. And then additionally, we do 3 sales a week. So with any, once you become a patient, you want to sign up to make sure that you're getting the text alerts for all the sales. So thank you so much for your time today. If you have any questions, Cindy's going to open it up for Q&A now. And thank you very much for your time. And I hope to see you at Liberty Health Sciences one day soon.
Okay, thank you, Stacia. So do we have any questions? I see Vicki. The name of the dispensary is Liberty Health Science. And the dispensary that we are currently at is on Biscayne Boulevard, and
it's 10795 Biscayne
10795
Boulevard.
10795 Biscayne Boulevard. So that's where we are right now, but they are elsewhere. Are there, you want to go on the camera there? Are there any other questions for Stacia? Okay, I don't see any questions. So you did a good job of explaining what we've got here. So thank you everybody for joining us. And as I mentioned earlier, this session has been recorded. So we will make it available to share. So it can be up in Ohio in no time at all. So thank you again for joining us this evening. And we hope you learned a lot and hope to see you on one of our other Lambda Living programs.